Thank you for joining us. We head down to South Africa, where the South African health authorities continue to battle a measles outbreak, which has now spread to 8 of the country's 9 provinces. The country's National Institute for Communicable Diseases this week confirmed that there were now more than 700 confirmed measles cases in the country.
Measles is a highly contagious disease which is caused by a virus which mainly spreads through infectious airborne respiratory droplets from infected persons when coughing or sneezing. The measles outbreak has now been declared in 8 provinces in South Africa except for the Eastern Cape. Now joining us to discuss this further is a medical doctor, Dr. Nombasa Mayeko. Good morning, Dr. Mayeko. Thanks for joining us.
Good morning.
Thanks for your time this morning. Yeah, kindly share with us if we are aware of where this outbreak started and the other areas in the country that are currently, at risk.
All right, thank you very much. The outbreak has actually started in Gauteng, since we know the Gauteng province to be the metro. Actually, this came because there was a test done. The first test that was done in Gauteng. But then when the outbreak itself happened, the highest numbers were more in Limpopo than other provinces, because by the 9th of March, the statistics that follow are that now by the 9th of March, there were about 255 cases that were determined in Limpopo, and there are about 196 from the northwest. Gauteng follows to be 107.
All right.
Was 107, and then Mpumalanga follows to be 102, and then KZN, which is KwaZulu-Natal, is about 17 cases by the 9th of this month, and Western Cape is about 10, and sorry, I forgot the Free State, which is about 27. Then the Eastern Cape has got 6, and Northern Cape only 7 cases that were tested.
Okay, let's talk about the vaccine. Of course, we know that South Africa has a measles vaccine, and the outbreak has unfortunately mostly affected children under the age of 1. How much coverage of the vaccine does the country have? And let's talk about the rollout plans. How successful have these been?
Yes, after these cases that were found, there were plans put in place, which was the Department of Health, together with NICD, they decided that they would have a mass vaccination for all the children in the country. And the vaccination it's actually done in the country for all the children at the age of 9 months. And then it's also repeated at the preschool age, it starts at about age 6 as they start to be in creche. And then now it was found out that post-COVID, the vaccination program itself was disturbed because of all the lockdowns and other things. Now, it was then determined that, okay, there should be every child that has been found that the mother doesn't know if the child was vaccinated or not. Every child then should get a jab. South Africa itself is prepared because it's also assisted by UNICEF and also assisted by the WHO on those on getting the vaccine itself. But the programs, they are fixed. We've got fixed vaccination programs for all children, starting from age 0 up to the age of school going. Now, the latest guidelines is that every child then that is at preschool should get a vaccine. All those from age 6 up to age 15 years, they should get a vaccine at their schools. So there are guidelines that are being followed at the moment, which is the latest things we are doing. So this program has started from February 2023. It's ongoing now.
Let's still talk about the vaccine. There are some speculations as to the vaccine causing adverse effects in children. Can you confirm this or not? Because what we're seeing is some parents are reluctant to give their children vaccination because they're worried about the adverse effects it is quoted to have. So can you tell us the true position on this?
The true position is that each and every individual is susceptible to side effects of any medication that is given to them, and it depends on which side effects are there. With the vaccine itself, yes, there are side effects that have been found, but what has been given to the Department of Health and also to the health professionals is that there are immediate side effects, there are intermediate and also long term, which those things they need to be observed. So there's teaching for also the parents to watch any changes in the child, that as soon as there are changes, the parents should go back to the centers where they got vaccinated so that the side effects are managed within a short while.
All right. I also want to talk, just slightly more. Can you confirm that these vaccines are available in all these provinces and they are free? And also, is there any, things that you can point out that may have stopped the ministry from achieving complete vaccination of children in these provinces?
At the moment, although I'm not a speaker for the ministry itself, but at the moment, the Department of Health is busy organizing these programs that should continue in all provinces. Vaccination itself in South Africa is all free. It's been free for as long as I remember. I'm in my 50s, we were vaccinated as children. We've been vaccinated all the time. There's been vaccines, even for the COVID vaccine that was there, it was also free, except for the people that were on medical aids who had to pay for it. But generally, South African vaccines are all free because the Ministry of Health has taken it to its own responsibility to prevent rather than to treat all diseases that can be prevented in the country.
All right, as we wrap up the conversation, let's talk about preventive measures that parents can implement in ensuring that they protect their children from getting the measles disease.
The first thing, a mother, as the child is born, is given a card which is known as Road to Health. And with Road to Health, the mothers should be strictly looking at those days that they are given by the nurses as they leave the hospital after the birth of the child. For example, when a child is born in the hospital or in the clinic where their delivery is done, before the child leaves the place, there are vaccines which are given from day one, and also there are vaccines which follow in 6 weeks after the child has left the hospital. And there are then dates which a child is given, that the mother is given for the child to come back to the hospital. In different languages, it is called according to that particular language. But in Xhosa, it is called, people are going eskalini. So the dates for escali, the people have to go there. That is, it's known as scaling, that is weighing the child and also vaccinating at the same time. So there are dates that are given. So each child and each mother should actually be aware that the child has to follow all those dates. And the second thing is that when children start to go at school, that is the preschool level, that is at 6 years, they get vaccinated. And all South African mothers, I think by now they should know that all children are vaccinated. Even themselves, they were vaccinated as they entered the school.
Okay.
In their own ages.
All right, thank you very much for joining us this morning. We do hope that South Africa is able to conquer this and it doesn't get even, get worse than it already is, or getting worse rather. Thank you very much for joining us.
My pleasure. Thank you very much for having me.
All right.